I want to now recognize Mr. Brown for an opening statement. Mr. Brown.
Thank you. Good morning to the members of this committee. Thank you for allowing me to share my story today. My name is Chris Brown. I am a nursing home worker from Chicago, Illinois. I'm also a proud member of the SEIU, Illinois, Indiana, Michigan, and Kansas. I've worked in the healthcare industry for almost 10 years. The first person I took care of was my grandfather with cancer. It was an entire family effort. When someone had to work, I was there making sure he had his medicine and was well taken care of. I was happy to help him and keep him at his best possible spirits. This is and was inspired to keep me and make me want to work in nursing homes. Although the work is very rewarding, I along with my other nursing home workers face many challenges. And the truth is, these challenges and these things was going on before COVID ever existed. One of those challenges are short staffing. I worked on a floor where the residents are bedbound, they cannot speak, they cannot move. It takes lots of physical labor to take care of these residents. We move them, make sure they don't get bed sores, we change their linens, and we change their soiled garments. Short staffing means less help. Now with COVID-19, short staffing also means we were coming into contact with more residents, even when our facility created a specific floor for residents who were infected with COVID-19. Short staffing means nursing home workers were being spread thin. When workers come into contact with more residents, the risk of exposure for COVID-19 is heightened. We don't know if the residents are tested when they arrive, if the residents are only tested if they show symptoms. By then, it may be too late. If I become sick, how can I take care of somebody else? Who will take care of me? If I end up working sick, the virus could spread like wildfire. If I don't come in, I risk not being able to pay my bills. If I have to choose between keeping the lights on or protecting my health. Being given low-grade PPE compounds these risks. I have more direct contact with residents than medical staff at nursing homes where I work, and I'm given a single-use mask. Some nursing home workers resort to saving their masks in paper bags as a way to ration them. What is worse, we did not have the policies in place to tell us whether we were working with residents infected with COVID-19 in my facility. I had to wait 4 weeks between the first case of COVID-19 appearing and the time I knew. I never knew whether I came in contact with the patient. If I was scared that entire time and eventually had to move out of my house because I was afraid of getting my family sick. I haven't seen them since. It's difficult not to be able to see your family. I have 13 brothers and sisters. We all work to take care of my grandmother who has dementia. Every day my grandmother is losing a bit of herself. And in these last precious moments, I'm going to miss because of COVID-19. But the time I have been spending with my grandmother, the time I haven't been spending with my grandmother, I'm developing relationships with people in the facility. Unlike my grandmother, many of these residents don't have family members. Sometimes we end up becoming the only family they know. So I spend time telling a good joke, putting a smile on the residents' faces and keeping them company. That's why we need to invest in nursing home workers and residents and address short staffing in both heavy emotional and physical labor. But it's easier to find people to do this work if they are paid what they're worth. If we value this work, our residents can live with dignity and comfort. There have been efforts at my facility to bring in new people, but unfortunately, these workers are too undertrained to provide the kind of help we desperately need. At most, they can pass out trays and they don't qualify to be in direct contact with residents. We need better training standards. Together with my union family, we have been able to make some progress. Nursing home workers across facilities lobbied in Springfield, Illinois, and shared our stories of being understaffed and working without benefits. Just recently, we were able to win pay increases for nursing home workers in Chicago after 5,000 people threatened to go on strike, including the $2 increase for hazard pay and an additional 5 days paid sick day. But it's still not enough. All these issues I mentioned are still there. These issues are not unique to my facility. Nursing home workers across the country say their residents are not adequately protected from COVID-19. They are also calling for paid sick days, double time hazard pay, and free testing for COVID-19. With the pandemic disproportionately affecting communities of color, and acknowledging the majority of nursing home workers employed in these nursing homes are Black and or of color, nursing home workers are getting hit hard. I continue to hope and pray for this change to be better. Our families depend on it. And I want to thank you guys for letting me speak.
Thank you very much, Mr. Brown. I would now like to recognize